In this I will be discussing history taking of headache in FCPS Long Case examination. Good morning, afternoon, sir. I am about to take a detailed history of this patient presenting with a headache. Introduction. Greet the patient and confirm their name and age. Begin with, can you tell me more about your headache? Presenting complaint. When did the headache start? Can you describe the headache in your own words? History of presenting complaint. 1. Onset. Was it sudden or gradual? Did it feel like a thunderclap? 2. Location. Where do you feel the pain? Does it radiate? 3. Character. Is it throbbing, sharp, dull, or pressure-like? 4. Intensity. On a scale of 1 to 10, how severe is it? 5. Duration and frequency. How long does each episode last? Is it continuous or episodic? 6. Triggers and relieving factors. What triggers the headache? Stress, light, or certain foods? What relieves or worsens it? 7. Associated symptoms. Any visual issues like blurring or flashing lights? Any numbness, weakness, or difficulty speaking? Do you feel nauseous or sensitive to light or noise? Past medical history. Have you had similar headaches before? Any history of migraines, hypertension, or sinus problems? Medication history. Are you on any medications? Did you take painkillers for this? Did they help? Family history. Does anyone in your family have migraines or similar headaches? Any family history of stroke or neurological illnesses? Social history. What is your occupation? Does it involve stress or noise? Do you consume alcohol, smoke, or use drugs? How has this headache impacted your life? Review of systems. Neurological. Do you have trouble walking or concentrating? Cardiovascular. Any palpitations or chest pain? General. Any recent weight loss or fatigue? Summarizing and closing. To summarize, you've had a headache for days, weeks, with characteristics and symptoms. Is there anything else to add? Thank the patient. Thank you. I will now proceed with an examination. Differential diagnosis. 1. Migraine, throbbing, unilateral, nausea, photophobia. 2. Tension-type headache, bilateral, dull, band-like. 3. Cluster headache, severe, unilateral, with lacrimation and nasal congestion. 4. Subarachnoid hemorrhage, sudden, severe thunderclap headache. 5. Intracranial mass, gradual onset, worsening, with neurological symptoms. 6. Temporal arteritis, age greater than 50, scalp tenderness, jaw claudication. 7. Sinusitis, frontal pain, worsens on bending, nasal discharge. This concise and structured approach ensures you cover all critical points effectively within the allotted time.